Namaskar. Today we will discuss about general overflow of the diagnostic pathology laboratory. Any diagnostic pathology laboratory works in three major steps. First step is pre-analytical stage. Pre-analytical stage means the stage before analysis phase. Before analysis. So, what do we do in pre-analytic phase? Pre-analytic phase, the most important point of the pre-analytic phase is patient preparation and sample collection, whatever with the sample. So, in the pre-analytic phase, we do the patient preparation and sample collection. Patient preparation means if you are taking the blood sample, you have to tie the tourniquet to the patient and make the weight prominent in adult patient and take the sample with the help of syringe as per requirement. If you need more testing, you have to take with 5 ml syringe, or if you are less testing, you may take with 3 ml. And after that, in pediatric age group, you have to do the sample collection very carefully because veins are very small. So staff should be trained to do the pediatric sample collection. And nowadays there are infrared lights are also available, vein locator, to take the sample collection properly. With the help of that, we can take the sample easily. uh, and other sample we also take sputum, CSF, fluids, urine, semen. These are the samples we can, etc. These are the samples we can take in pre-analytic phase. And pre-analytic phase, one of the most important factor also is you have to label the proper label the containers where there is EDTA plain or urine container, semen container, or fluid container, any container. You have to label the proper name, age, sex, mobile number of the patient you have to take and label the patient because it is very important. It is the very important step, labeling, because if labeling got wrong, then the patient will suffer because this patient's report is also wrong. So labeling of the samples is very important in pre-analytic phase. So this is pre-analytic phase, and for various testings you have to collect the proper sample. Like for example, for a complete blood count you have to take in EDTA, and EDTA for ESR, erythrocyte sedimentation rate, you also take in EDTA, and various biochemical investigations like KFT, LFT, electrolyte also. There also and amylase and various biochemical investigations are done in many investigations are done in plain container. And for prothrombin time INR, you have to take in the citrate bulb. This is the basic steps to for sample collection. Okay, so this is about pre-analytic phase. Then second phase is analytic phase. Analytic phase may we do the testings of various tests as advised by the treating doctors, like urine routine microscopy, CBCS, or whatever be the test advised we do in the analytic phase. In like for example, electrolyte is done on electrolyte analyzer, all biochemistry testing is done on biochemistry analyzer like KFT, LFT, वगैरह वगैरह, and complete blood count is done mainly on hematology analyzer, and urine routine microscopy is done on microscope, and various peripheral blood smear and various other testing are also done, semen analysis and various other testings or drugs are done with the help of microscope and other machineries. Every report is confirmed by pathologist on microscope and his in his presence. Okay. And the third phase is post-analytic phase. Post-analytical phase is also important. In post-analytical phase, we enters the reading. We have done the testing of the patient. You have to enter the reading in the pathology software and enter the reading and approve it by registered pathologist, and then the report generated and it will be submitted to the any doctor, treating doctor or the patient. Thank you.